Did you know pleasure may be the answer to your client's pain? Today's guest will share her secret she discovered in the 40 plus years working with chronic pelvic and abdominal pain in her physical therapy clinic. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. All right, hello everybody, and today I am so excited to introduce you to Dee Hartmann. Dee is a physical therapist and an author, educator, speaker on the treatment of chronic vulvar pain and sexual dysfunction. And in 2021, Dee co-authored this amazing book, The Pleasure Prescription, A Surprising Approach to Healing Sexual Pain with Elizabeth Wood. And Dee has also been actively involved in many organizations, including the APTA and the ISSVD. Dee, tell us a little bit, what is that?
The ISSVD is the International Society for the Study of Vulvovaginal Diseases. When people usually go, "Oh, nice."
Right. Yeah. Well, and you've been a fellow on there, and you were really instrumental in helping to figure out the VV guidelines, right? The vulva.
With Vulvodynia Guidelines, I had the honor of being one of the co-authors for the Vulvodynia Guideline as the only physical therapist. So yes.
Well, great. Well, thanks, Dee. Welcome to the show today, and I am so excited to dive into our topic today, which we're really going to be discussing this idea of treating vulvar pain with pleasure. So that is kind of revolutionary there, Dee. Who would have thought that pleasure could be our answer to vulvar pain? So, how did you discover this?
It kind of has a long story, and I'll be as brief as possible. At one point in my wonderful career, I was asked to work at a sexual dysfunctions clinic in Chicago in the early 2000s. I was there as a women's health physical therapist, and Elizabeth, my co-author, now buddy and dear friend, was there as a sex therapist. So we met there. Fortunately or unfortunately, our participation there was very short-lived, but we became soul sisters. She
Mm.
left the clinic, left her certification, her licensure behind, because she really didn't feel like sex therapy was getting to where she needed to be. So she became interested in tantra, in yoga, in orgasmic function, in somatic sexual healing. And she then developed that practice. We stayed very connected. I would call her, "Elizabeth, I have this problem." She would call me, "Dee, I have this problem." And I saw from that perspective what she was doing, which was obviously totally opposite of what I was doing. And I learned so much from her. I closed my practice. She asked me to help her. I failed at retirement, got to the book, and today. But what we also know is that studies show us that we're really good at getting rid of pain, vulvar pain. And in this case, it happened to be vulvodynia because that's where all the research is, but it doesn't have to be vulvodynia. Vulvar pain is caused by any number of things, as we all know. We know from the literature that anybody and everybody who treats chronic vulvar pain is able to get rid of it, whether it's physicians with drugs or surgery, whether it's PT, physios, or whether it's psychologists. Whatever the case, we know that those women who get rid of their pain, we treat them, we say, "Okay, thank you, we're done, your pain is gone, we did our job, now it's time for you to go out and do your job," that women have, for the most part, no clue. And the literature proves that out, that women who have a history of chronic, more than 3 months, vulvar pain never reach the sexual function of their pain-free peers. So it became very obvious to me. I mean, I've been talking about sex. I talked about sex at Combined Sections at 1997 to an audience like this. So I've been talking about sex to my patients for a very long time. I've talked about self-pleasuring and orgasm and all that stuff. But even I, with my knowledge and my expertise with doing that, my patients, a lot of them got back to having sex, but it's the hardest thing in the world to get them to do. Now, with Elizabeth, we're joining together and really encouraging people to add pleasure in and more of it, and not just sexual pleasure, but sensual pleasure. And that's what the book truly is all about.
Right. And Dee, I've known, I guess I've just had this gut instinct that the sensuality leads to sexuality. And you even have a graphic in your book where you have sensuality and sexuality and where they overlap. What's that in the middle? That's like,
Well, that's where good sex happens.
yes.
That's where it happens. I mean, if you think about it, if your partner, whomever that may be, if you really don't like each other, you never touch each other, you never make each other happy, you never talk, you never do these things, you just raise the kids if you have kids, or you just do your jobs, or you do, or you're menopausal, wherever you are across the life cycle, and you jump in bed and you're supposed to have this hot, awesome sex.
It
You
doesn't
don't
work
even
very well.
know.
Yeah.
No. And Elizabeth says we need to fill our pleasure bucket.
Mm. And so in your mind, does pleasure and sensuality kind of, work together, or and how does that work?
The word pleasure itself, will suggest, has been hijacked to include only sexual pleasure. And I mean,
Mm.
again, in the literature, it's fascinating. You look and you ask people to, there's a great study, what in your life is pleasurable? And people have no clue what to say, because the pleasure isn't a word that we use across all of our lives. So, so pleasure and sex, yes. Pleasure and sensuality, yes. Pleasure and good communication, yes. I mean, we take pleasure, but again, we have to take pleasure. It doesn't just come to us.
Say that again. That's important.
We have to take it. We have to say, God, isn't that a beautiful sky?
Yes. I tell this to my clients all the time. Especially our new moms with babies, they're so busy, so distracted. And I'm like, look, it doesn't have to take long. It's just a moment, right?
It's
It's a
just a,
moment or two.
and instead of always being, oh God, I'm so tired. Oh God, I got to do this because the baby's sleeping. Oh God, there's another dirty diaper. There's the phone. I got to do the
Yeah.
laundry. Take 2 minutes. I mean, not even 2 minutes. Take 2 seconds
2 seconds to just notice the beautiful sky, to notice, to smell the roses, so to speak.
and to look at your baby and say how gorgeous you are. I really do love you so much.
Yeah, well, that I'm sure comes easily for most, not everybody. I know there's issues, but the sensuality is so important. Just wearing comfortable, nice clothes, picking the color that makes you, I like this color a lot, so this makes me feel good,
Yeah.
right?
Right.
And I tell my moms, wear jewelry or wear a bracelet if that makes you feel special, right?
And part of it is that I think there's a physiologic piece with the production of oxytocin. That when we nurse, if women are nursing or if they're feeding or if they're holding this new baby, we're mammals. Women, female mammals, taking care of our new young. And that produces oxytocin. So that gives us our feel good hormone right there. So we really, there's a piece of that balance that we have to go over the top. We have to do more than just that, because we have that. But like you say, light a candle. If you can find time to take a bath, I know if it takes, if you can do it during nap time rather than nighttime when you need to sleep, um, go outside and get some sun on your face. Anything that brings pleasure that you enjoy.
And one of the things that I like to tell my clients is that sometimes we do these things for our good, right? Like I'm supposed to exercise or I'm supposed to get sun on my face. But if we don't do it with pleasure or with that sensuality, it's like we're just checking it off of the box of our, a list. and we're not really bringing it in deep into our body. To me, this sounds a lot like this pleasure, the sensuality is really about embodiment.
That's the perfect word to use. We have to accept it into our lives, and again, take it into our lives as just that. It's a gift. I mean, oftentimes when I
Ah,
sign a book, pleasure is a gift that we give ourselves.
ooh, I love that.
We can take it or not,
Right.
but it's free. It never wears out. There's an endless supply.
Yeah.
We just have to, it's a state of mind. It's embodying it, exactly embodying it exactly.
The awareness of I'm doing this to pleasure myself. I'm doing this to feel good.
And that's okay.
Yeah. Oh, amen.
That that's
Amen.
okay. It's okay to
Yes,
make yourself feel better. I mean, we as women get so involved in everything else and making everybody else feel better. We,
absolutely.
we're always at the bottom of the list. And that's life. That's just what it is. But
Yeah. So, Dee, explain to me then, how does this pleasure help someone who is dealing with vulvar pain?
someone who deals with vulvar pain, and again, from wherever they are in the life cycle, if it's something that is so prominent in their minds, and oftentimes it is, in particular, if it keeps them from having enjoyable sex with whomever it is they're having sex with, um, they have that focus that takes over so much of their lives. And if we can begin to add pleasure, it kind of balances some of that out. Stephen Porges was asked, it wasn't about this in particular, about getting rid of as a system that gets rid of negative memories. And the author or the creator of this system said, well, asked Stephen Porges, well, how do you think that makes things get better? And his thought was, if we can eliminate more of the negativity in our brain, we have more room for the positivity. And I think that whether that's true or not, it came from Stephen Porges, so I'm going to believe it because
Yeah,
that's
right.
why.
Well, Stephen Porges is well known for his polyvagal theory, correct? So,
Exactly. Yes. Very good. Yes. So, I I know, I think everybody knows when you're in a bad mood, you have a crummy day, and when you're in a good mood, you have a better day. And if there's a way that we can impress upon our bodies, on our minds, on our being to be a little happier, to be a little better. And if isn't it, smell a candle, light a candle. If it's
yeah.
bake some cookies, I don't care. You have to eat them or not. I don't know. Whatever you can do that just makes you feel good.
So is that's the we're just people who are in vulvar pain tend to, whether it's provoked or non-provoked, doesn't matter, but they're so focused on the pain that they just keep focusing on the pain. So the pleasure is just giving them something else to focus in on, in hopes that greater input of pleasure will override the pain signals.
Right. And I think that really also plays a role, and I know we're going to talk about this more later, plays a role in their active love play and attempt to have sex. Because if they've had pleasurable sex, this is kind of goes back to the same thing. If they've had pleasurable sex in the past, they need to think about that as they get into the bed, rather than, oh God, this is going to be horrible. I know this is going to be awful the
Yeah.
last time. So that kind of premise holds there as well. And I think that it rides well with everyday life as well.
Well, and I think those, when we're talking about postpartum healing and a mom who's taking care of these newborn babies that, they truly, especially first time moms, have no idea what they're doing, right? You learn, trial by fire. And then, jumping into bed, like you said, and they have to, now turn it on. If they haven't, I feel like we need to be bringing pleasure and sensuality throughout the day to our daily life, so that when we jump into bed, there's already somewhat of a fire happening in there, so that we're not going from cold to, now I have to get totally turned on. And our moms are just, there's so much output in taking care of a newborn baby and taking care of toddlers and everybody else. I was sharing with my clients, what I share with my clients is like, a lot of times they feel intercourse is just one more thing they have to do,
Sure.
versus intercourse being something that could actually fill them up, like for them to receive from their partner, to help them
Yeah.
to be open to more of that pleasure, instead of something like, oh, I'm doing this for my husband. What if they could turn it around and see that their husband is actually doing something for them?
Oh, absolutely. And we talk about 24/7 foreplay in the book. Um,
I love that. 24/7 foreplay all day long.
Absolutely. And again, it goes back to that same premise that if you never do anything you like, you never do anything nice for your partner, you never talk, you never touch, you never hug, you never kiss, and then you jump in the bed and all of that's supposed to be good. On the other hand, if your husband empties the trash, heaven forbid, and you do nice things for each other, and you maybe go out on date night, you talk to each other, you touch each other, you kiss each other, you tell each other you love each other,
Yeah.
it's amazing what a difference it makes when then that duty of sex becomes something that's integrated into your day every day,
Yeah.
because that's a sharing of caring more
Share.
than anything.
I love that. That is. And so we can't just keep sex to the bedroom.
That's exactly right. That's exactly right. And you also have to remember there's another mammal that I just read recently, which was new to me, that humans are the only mammals that after we deliver our young are expected to then have sex for procreation when we're still taking care of a new baby.
Oh, interesting. So you're saying
So,
other animals don't, other mammals don't have sex when they're caring for a newborn.
no,
Interesting.
no, and that's we're built to be the sole provider, because if we're not, unless somebody else is, obviously, but in the mother baby scenario, we are there with the sole purpose of keeping this very dependent little creature alive.
Yeah.
Oh, wait, we have sex too? Oh,
Yeah. Well,
so
if we think of it from an evolutionary standpoint, then, and like other mammals, they're only using sex for procreation, then we're using it for pleasure.
that's not quite totally true, because when I think about all the rat research that goes on with vulvar pain, yeah, they stimulate rat clitorises and they have sex all the time, and it's not for procreation, but
Okay. Okay. We're like rats then. Okay. So Dee, let's is there more that we need to talk about with this pleasure concept? I know one of the things that I read in your book was about when we have our clients that have pain with insertion, penetration, that it's super helpful for the woman to have an orgasm prior to penetration. Tell us more about that.
it was so interesting because in my practice, which I was in the clinic for almost 30 years, specializing in treatment with chronic vulvar pain, women with chronic vulvar pain, and I'd ask them in the history if they've ever had an orgasm, and a lot of them would say no. And then as we got farther down in the questioning, well, do you self pleasure? Oh yeah, I do that all the time. Women who would self pleasure and have orgasm didn't consider having or not having orgasm with sex in the same way,
Oh, interesting.
which was always very interesting to me. So trying to get them literally to self pleasure prior to penetration was a hard thing to do.
Why is that?
Beats the heck out of me. I don't know if it was because they thought that, well, my husband won't think I need him anymore, or whatever. It never made any sense to me, and I didn't ever ask. I can't have to say I didn't ever ask, but it was really hard to do. And I don't know if women were embarrassed. They typically didn't self pleasure in front of their partner. So it was something that I think it's all cultural stuff. I mean,
Sure.
women are supposed to touch their clitorises. We're not supposed to self pleasure. We're not supposed to enjoy what we have in our body. So I think that probably was a piece of it.
Dee, don't you think? I mean, I'm thinking like I think men enjoy seeing us self-pleasure.
100%. 100%. But we don't stop to think about that, because again, aren't we supposed to please them? They're supposed to give us an orgasm, right? I mean, I've
Okay,
1,000
but
times.
here's the thing. If we're not communicating with us, they have no idea how to do it effectively.
Well, if we don't even know how to do it,
Yes.
and therein lies the root of the problem and the purpose of that blue book you held up. Really? Yes. This book
Yeah.
will help women do just that. And that's to find their sensuality and then find their sexuality so that first and foremost, they can do it for themselves for their own pleasure, which is really, really important.
Yes.
Then if they decide they want to share it with a partner, then there's another couple chapters that they can share it with their partner. But if they bloody don't know how to do it, how are they supposed to help
Their
do
partner do it. Yeah.
it?
Right.
Yeah.
Well, I think an important point I want to get across to everybody listening in is that a lot of women, the anatomy of the clitoris does not lend to having orgasm with penetration, correct?
Well, it's a very interesting thing. And I have on black. I didn't even realize when I was doing this.
Look at that.
Gee, this is a nifty little model of a clitoris. It's twice the size, mind you. It's all clitorises aren't bigger than your fist.
Yeah. Okay.
But it's a phenomenal model that's actually made in Germany. It's a two-piece model
Oh, nice. Okay.
where the clitoris, and I'll talk about this in just a second, actually nestles and lives right on top of the urethra and the vagina. The clitoral bulbs you see don't come all the way down to the perineal body, as you oftentimes see them drawn in pictures. We have the glands here, the opening to the glands, and they're here below that. The name of those glands have escaped me right at the moment. If you can help me, it will be good, but whatever. So
Yeah.
take a look just at the clitoris. What you see, there's the side. I'll do it on my sweater because that worked. Oh, that kind of
Yeah.
looks like babies. I don't know. If you can see the pink part of the clitoris, the neck, the knee, and the crura, or the legs on either side, are actually erectile tissue. Similar to the penis, but a clitoris is not a small penis. I won't go into that rant, maybe in the other next section.
Okay.
But it is erectile, just like the penis. So when there is sufficient arousal, this pink tissue all gets erect, it gets firm, it gets stiff. The clitoral glands lifts up just a little bit, and the clitoris gets erect, if you will. During that arousal process, we have a huge influx of blood flow, which is what helps with that, which also fills the vestibular bulbs, which are attached by a small piece. You can see that little purple line here to the clitoral glands, which is a different type, has a different embryologic origin. It is cavernosus material that just like bulbous material, just like in the penis, but it swells and gets bigger as it swells and engorges with blood, which pushes the nerve endings closer to the surface. Included in those nerve endings are Pacinian corpuscles, which, when they're stimulated, tell our brain, ooh, that's nice. So imagine that if the clitoris gets erect, it gets a little firmer, the blood flow increases the size of the vestibular bulbs, and the vestibular bulbs sit right on top of the vaginal opening. What's going to change at the vaginal opening is a bit of pressure to the inside. So that if you have full arousal, and according to Elizabeth, can take up to 40 minutes, we think that we should be able to do this really fast, and it doesn't always work that way. With full arousal, you can get these bad boys larger. So with penetration, there actually is stimulation to the clitoral complex, not to the clitoral glands, but to the clitoral complex, that can help increase orgasm and provide for vaginal orgasms.
Okay. So you're saying that it is possible to have vaginal orgasms with penetration?
Well, and there is, and we know from the literature that as many as, and it's really variable, 20 to 25%. Again, this is self-report. And typically the literature suggests, well, these are women are reporting that they have orgasm with penetration, but we don't know if they're stimulating the clitoris while they're doing that. We don't know if they're using a vibrator while they're doing that. We don't know how it happens because we are tied to using stupid validated questionnaires, which just for the record, I'm working with a group on a systematic review who dissed the FSFI as not being inclusive enough because it doesn't ask enough questions. So that's what the literature suggests. Is it true? I don't know. I mean, who knows? But who knows if any of the literature is true, right?
But I guess it's important for us as practitioners to let our clients know that sometimes it's not possible.
Most likely it's not possible,
Yeah.
especially if there's an issue, especially if you're postpartum,
Yeah.
unless you've been hugely orgasmic with penetration before. I mean, we can't expect if you weren't orgasmic before at all, and now you're postpartum and you can't understand why you're not having an orgasm, or if you didn't like sex before and now you're postpartum and you think you should like it more, let's be real.
Yeah.
You know, I mean, getting back to norm at some point in time, if you want to get better, and you want to improve your sex life and you want to talk more about all this stuff and arousal, that's great. But the postpartum period isn't a good time to start with.
Right, right. Let's be more educated prior to this point so that when we do get it, we can handle the changes that delivering a baby vaginally brings to this area. I did hear that it takes 45 minutes for a postpartum mom to get aroused.
It wouldn't surprise me.
Yeah, and I'm thinking that a lot of postpartum moms don't have 45 minutes to give themselves.
Most women in general, let's be
true, right? Not
whether
those
have a new
taking care of a
baby,
baby.
right? It takes time. And what I also found in my practice, which I closed in 2017, that more and more, working households. So you've got both partners who work. Not only do they work, they have to see all their friends. They have to go out. They have to do all this partying, and to think that they're going to take 45 minutes, an hour to have sex is just totally not even an option. Who
Right.
has time? I mean, so many patients in my office said, I just don't have time to do that. Okay.
Yeah, but what are we going to prioritize? That's what we need to help our moms. Dee, another aspect that I want us to just touch on briefly is that as practitioners, like I had no idea when I got into doing pelvic health that I would have to become this sex educator. And I think a lot of us fall into that role because we're talking about and we're working in this area. And I have to say, I grew up Catholic and I grew up very conservative. And so I was pretty uncomfortable at the beginning of my career doing intravaginal work, really talking about sex with my clients. But over time, I've become more comfortable. And I think a lot of that is because I've become more comfortable with sex myself.
Sure. And I mean, my parents were Southern Baptist. Okay.
Oh, okay.
We didn't hug, we didn't touch, we didn't say I love you, we didn't really do much of anything. So people who know me look at me, and the rest of my family say, I don't know how you got here. And my kids, oh my God.
Oh yeah.
Just don't get it all. And when I made reference to the fact that I stood in front of CSM in 1997, and to be clear, all I talked about was sexual dysfunction, because that's really all we knew. We could talk about it, we could ask about it, but that's all we knew. There's so much more information out there now, and it's just coming out. I mean, it's really just coming out. We didn't know about the full anatomy of the clitoris until 1996. So, women's sex is dirty. Let's be clear. We don't want to talk about it. We're not supposed to do it. So anytime you can bring it up and ask about it, physicians don't have time. Physicians don't have time. And people get mad all the time. Women get mad. People in meetings get mad. Other physical therapists, everybody gets mad because they don't bloody have the time. They don't have the knowledge.
Yes.
And unless they really specialize in sexual health, which a lot of them do, but you've got to find somebody who's reached out and who's done that and who's interested. I think that women's health PTs are at the perfect spot to do this. We spend time with our patients every week. We develop amazing relationships with them. They tell us, and we know they tell us things that they never told anybody else before,
Yeah. Yeah.
right?
Yeah.
And we're right there.
Yeah.
We're right there, which is what drives me to do everything I'm doing today. And that's educating and trying really to get the information out there, starting not from the dirty side, but from looking at anatomy and from looking at function, because we as PTs, that's our forte. And that's
Absolutely.
really
And we need to educate our clients about the function of it and how things work. And I think that just this educational piece of, hey, have an orgasm prior to penetration, you know?
that was how we got all this started, right?
Yeah.
Yes, which we know having sex in an unaroused, unclimaxed vagina is very, very, very different
Well, and
than
more
having
painful, I would imagine.
way more,
Yeah.
way more, way more. We also know that it helps with fertilization. It was suggested that it helps with fertilization too, because it with the mucus helps change the pH of the sperm. And if we don't have that interaction, the sperm isn't fertile.
So
So
you're
if
saying that by having an orgasm, it changes the environment and it increases potential for fertilization.
we're supporting a study through the Center for Genital Health and Education that's looking at changes in reproductive hormones using hypnotic orgasms.
What? Tell me more about that.
Yes.
That's cool.
You can induce orgasm in hypnotic patients sitting in a recliner, male, female, fully clothed, ever many people you want in the room, but with a good hypnotist, and you can see the response of the orgasm. And we're looking at their blood work before, immediately after, 10 minutes after, 15 minutes after, half an hour after, to see if orgasm, in particular, at mid-cycle in women who are cycling and not on oral contraception or not on any contraception, to see if it increases FH,
It increases what?
follicle,
The follicle
follicle stimulating
stimulation
hormone,
hormone. Okay.
to see
Wow.
if in fact it could. We're trying to prove it. I quoted what I quoted from a paper that I've read, but we're looking to prove it through actual research, because imagine what that could do for orgasms if we found that it helped improve fertility.
What? Yes. Oh my gosh, that's amazing. That is amazing. Way cool. Way cool. Oh my gosh, Dee, I know there's so much to talk about this. I think one of the pieces of the puzzle as practitioners, so I've said this earlier, that we need to be comfortable talking about sex with our clients. And we need to understand more the function of the clitoris and the anatomy and help educate our clients in this more. And your book does a beautiful, beautiful job of doing that. So I have really, really enjoyed this book, everybody. So I encourage you to please check it out. Let your clients know about it so that they can read it and just become more familiar. Are you familiar with the website omgyes.com? What are your thoughts on that?
I haven't spent a lot of time there. Elizabeth could tell you probably what every click on is on the page. She's a
Yeah.
big owner, but I haven't gone there. There are a number of websites, and there are a number of other books that are fabulous references for any healthcare provider who is interested in clitoral function and sexual function, that that are available. And I think that our book is just one of many.
Well, but I think what's unique about your book, Dee, is the connection between pain and pleasure and how to help someone who is having pain with intercourse to be able to have intercourse without pain.
Yes.
And that is your unique approach with this book, and it's brilliant. So
Thank
thank you. Thank you for that work.
Thank you.
Yes. And in fact, so do you have any parting words here for our listeners? Anything else you want to say before we?
I think that, pardon me, that probably imparting the pleasure piece and work on it every day.
Yeah.
Just pay attention and bring pleasure into your life in a simple way and see how it impacts you. Notice the sky, feel the soft skin, smell, smell the air, taste wonderful food, and recognize it.
Yeah.
Take note of it and start filling your pleasure bucket every day so it doesn't run out.
Beautifully said. Beautifully said. Boy, if we could all just take those words to heart and to do it, boy, what a different world this would be.
Yes, I totally agree. Thank you.
Yeah. Yeah. So everybody, please, in the show notes, we'll have a link to the book. Dee, did you have a chapter of the book that we might be able to let people sample before they purchase it?
As we talk and as we have come through the discussion, I would love to be able to share the chapter on sensuality.
Okay.
Really to help people move along. Each chapter starts with a case study and ends with a set of prescriptions and
Practices that you can do.
practices and things that you can do that pertain to that chapter.
Yeah, it is so beautifully written. So well done. And please, everybody, check it out. It is so important for our knowledge as practitioners and for those that are dealing with vulvar pain and wanting to have more pleasurable sex.
Thank you.
So,
Yeah. It is on Amazon, so you can find it there.
okay. All right. We'll have the link to that in the show notes, everybody. So thanks so much, everybody, for listening in. Dee, thank you so much for your time, sharing your wisdom with us. And we will see everybody on the next episode. Take care. Bye.
Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To learn more, visit instituteforbirthhealing.com. Use podcast 50 to receive $50 off of any online course.